We're talking today about plan control in the context of data. From our point of view, admittedly, we have a view of data that may not be typical, but nonetheless, we view a major part of plan control as having control of the data. And there's two ways of looking at this, and we're kind of giving you the negative image on this slide. Imagine no data. There's very few plans that have no data at all, but there are some that are severely limited in the data they get or can use, and some, for all practical purposes, have no data, even though they may be awash in reports and statistics. But if you think of the lack of data and what it does to plan control, first of all, you're very vulnerable as a self-funded plan fiduciary. Ignorance, not knowing what's going on, not having the information that you need to exercise your fiduciary control and oversight. Lack of data and ignorance is no defense. The law does not say, well, you have fiduciary responsibility unless you can't get the data, and then we sort of understand, or if you're not comfortable with data. Having data and being able to monitor the plan is a fundamental fiduciary responsibility. Now, there's a lot of different levels to that, but it's key to that success. Groups that are relying on their payers to self-monitor are invariably disappointed. Not because the payers are lying to them, but just because every payer has a different perspective than the plan itself. And the way they're going to view things is not necessarily the way the plan is going to do it. And the plan fiduciary cannot delegate this responsibility to their payer. They can't say to the payer, well, you make sure everything's okay and call me if it isn't. That just is, it never works. It always results in unpleasant surprises later on, or things happening that aren't what you expected, but you didn't have any way of knowing it. Even at a more fundamental level, think of any management process, and if you can't measure it, you have a very difficult time managing it. Apply it to any line of work that you're in or any business that you've worked with. Having the data to be able to do the measurement of what's going on in the processes that you're overseeing is a key part of that management oversight. The other thing that happens if you have no data is that overpayments and abuses simply go undetected. The incentive for others to find these are not the same as they are for the plan itself and for its fiduciaries, and even payers that are exercising diligence in claim payment are not going to have the incentive to go as far and dig as deep. They only get so much in administrative fees. For some of them that get paid on some kind of an incentive basis, it may actually be not in their interest to find these issues and just sort of let them go. So again, if you don't have the data and you're relying on others to tell you what's going on, you're going to miss things. Also, if you're trying to decide what to do, where do we go, what do we do, what's the next initiative that would have the most positive impact on our plan in the short term or long term or whatever it might be, without data you're just guessing. And you're essentially relying on sales pitches, not facts. And the person that comes in that has the best patter and tells you the best story has a very good chance, even if what they're proposing isn't really what will do you much good. And because you don't have the data, you don't have any way of knowing that, and you have to rely on gut instincts about what a person's selling you.